Okay, good evening, everyone. So welcome to our Facebook Live event and thank you for tuning in. My name is Anna Delmadoros and I'm an optometrist based in Sydney with special interest in eye disease. Tonight, I've been invited to talk to you about the risk factors for glaucoma. Now, why is this important? Well, risk factors have a critical role in the prevention of vision loss when it comes to glaucoma. Identifying risks that are linked to glaucoma and then acting on these is a proven and successful strategy for preventing vision loss. I can talk for ages about glaucoma. Ask any student who sat through hours of my glaucoma lectures, but I will do my best to be as concise as possible. So in tonight's presentation, we will cover a brief overview of glaucoma. We will identify the risk factors for both developing glaucoma and also for worsening of already existing glaucoma. And finally, we'll discuss what can be done to prevent vision loss from glaucoma and how we can all actively contribute. Also, to get the formalities out of the way, I have no financial interest in anything that I'll be talking to you about this evening. So to briefly review, glaucoma is the name given to a group of eye diseases that damage the optic nerve. That's the part of the eye that connects the eyeball to the brain and contains those delicate, sensitive nerve fibers which carry the visual information from the retina to the brain for interpretation. Now, the insidious nature of glaucoma means that damage to the optic nerve often develops slowly and mostly without any noticeable symptoms until there is severe vision loss. And this is why glaucoma is known as the silent thief of sight. In fact, in Australia, it's estimated that over 300,000 people have glaucoma, yet only half of them have been diagnosed. Glaucoma is a complex disease and our understanding of the exact cause is still evolving. There are many types of glaucoma, but in most cases, it's the effects of a high pressure within the eyeball that causes direct damage to the optic nerve. And this is the underlying reason for vision loss in a type of glaucoma called primary open-angle glaucoma, which is the most common adult form of the disease, accounting for about 90% of cases in Australia. But high eye pressures don't explain why glaucoma develops in people with normal eye pressures, aptly known as normal tension or pressure glaucoma. And in these instances, researchers have proposed a poor blood supply to the optic nerve or an inherent weakness in the structure of the nerve itself. And there are other theories as well. Regardless of the damage mechanism or the type of glaucoma, what we do know for certain is that when left untreated, glaucoma leads to irreversible vision loss. And although there is no cure, treatment to lower the eye pressure through the use of eye drops, laser or surgery is a proven and effective strategy to prevent, delay or stop damage from all types of glaucoma. Now, it is important to remember that anyone can develop glaucoma, but some people are at a higher risk. So let's go through these risks. And if you find you have one or more of these risk factors, arrange to see your optometrist to get tested. Remember, when we detect glaucoma early, we can prevent vision loss. So glaucoma can be inherited, and researchers have identified many genes relating to different types of glaucoma. The fact is, if you have an immediate, direct family member with glaucoma, then you're up to 10 times more likely to develop glaucoma in comparison to the general population. And having a sibling with glaucoma carries the highest risk. Added to that, if the family member has advanced glaucoma, then that risk is said to double. And this is why family history plays a key part in identifying high-risk individuals. So we encourage everyone to be proactive and to find out whether anyone in the family has glaucoma. And to take this a step further, see if you can find out the type of glaucoma, the severity, and when it was diagnosed. This is all very valuable information for your eye care practitioner. And if you have glaucoma, well, let your family members know. It could potentially save their sight. One study found that approximately 60% of people with glaucoma had at least one family member who also had glaucoma. Ethnicity also plays an important role for developing different types of glaucoma, and this has been well documented. So people of African descent are at a significantly higher risk of developing primary open-angle glaucoma than those who are Caucasian. The glaucoma also tends to be more severe and develops at a younger age. Now, people with Hispanic heritage are also at higher risk of open-angle glaucoma, especially in the older age groups. People of Asian descent have a higher risk of primary angle closure glaucoma than the other ethnic groups. Now, this is the less common type of glaucoma that makes up the remaining 10% of glaucoma cases in Australia, and it differs to open-angle glaucoma in it has symptoms in acute presentations which require immediate medical attention. Now, people of Japanese descent have been reported to have a higher risk of developing normal pressure glaucoma. And also worth a mention is a type of glaucoma called pseudoexfoliation, which, although is found worldwide, it is reported to be most common amongst those of Northern European origin, particularly those of Scandinavian descent. Age. So although anyone can get glaucoma, including babies, the risk of glaucoma generally increases with increasing age, and people over the age of 60 are at greatest risk. Now, the next few risk factors that we will be talking about are intrinsic to the eye. So most of us are familiar with high eye pressure as being one of the major risk factors for glaucoma. 10 to 21 millimeters of mercury, which is the unit of measure for pressure, is the range of normal eye pressures, and it's well established that having pressures above this range is a strong and consistently proven risk factor for the development of glaucoma, and also for the worsening of existing glaucoma. Remember, there's usually no symptoms, and only an eye pressure check at your eye examination by your optometrist or ophthalmologist can detect high eye pressures. Now, our eye pressure, much like our blood pressure, doesn't remain constant, but normally varies or fluctuates throughout the day by about 2 to 6 millimeters of mercury. Larger fluctuations in eye pressure have been shown to translate to an increased risk of glaucoma, and this is why you may find when we test for glaucoma, we may ask to measure your eye pressures at different times of the day, either on the same day or over a few days. Now, in addition, certain activities have been shown to cause large fluctuations in eye pressure, even up to 40 millimeters of mercury in some instances. Now, these temporary but significant increases in eye pressure are what we refer to as spikes in eye pressure. Now, the question arises is, do these spikes in eye pressure, when repeated multiple times, increase the risk of glaucoma by a little or a lot? Well, we don't have a definitive answer as yet, but given there is a connection, it would be wise to consider these activities as potential risks for glaucoma. So here are my top 10 activities that have been associated with spikes in eye pressure. And this is not an exhaustive list, and activities are in no particular order. So we'll start off with inverted yoga postures, such as those shown, where the head is below the level of the heart. Playing certain wind instruments that require a lot of force and lung power, like the trumpet, the trombone, the tuba, and the bagpipes, and the time spent playing these is also important. Wearing small swimming goggles that sink inside the eye socket are of most concern because of the direct pressure on the eyeball. Wearing tight neckties or even a tight closed collar shirt, not only can this increase the eye pressure, it's also been shown to restrict blood flow to the brain. Caffeine consumption, whether in coffee, energy drinks, and even some foods, can increase the eye pressure for up to 2 hours. Significant spikes in eye pressure occur with heavy caffeine consumption in some people, which is the equivalent found in about 3 standard cups of coffee. One major study also found an association between heavy coffee consumption and increased risk of pseudoexfoliation glaucoma. Drinking large or excessive volumes of water in a short period of time can not only cause a spike in eye pressure, but also be detrimental to our health. Now, you may recall the dreadful incident when a woman died of water intoxication after drinking over 6 litres of water in 3 hours as part of a radio station competition. Now, our eye pressure naturally rises when we lie on our back, but sleeping in a position where there's direct pressure on the eye, such as sleeping on the side when the head is turned into a pillow or an arm, can cause spikes in eye pressure, and sleeping face down increases the eye pressure even more. Weightlifting can cause a significant spike in eye pressure. Holding one's breath while lifting the weight increases the eye pressure even further. And bench pressing is also a concern for 2 reasons: the strain of the bench press itself and from lying down. Add to that breath holding and there's triple the risk in one action. Now, there's some evidence that there is a link between the level of blood pressure and the level of eye pressure. So if we get stressed, both the blood and eye pressure can increase. Rubbing the eyes vigorously can cause dramatic spikes in the eye pressure, especially when some use their knuckles to rub, which we tend to see more frequently in people with untreated eye allergies. Now remember, studies have linked these activities to spikes in eye pressure, but not conclusively to glaucoma. So while there may be or may not be a meaningful connection, it would be appropriate to keep in mind that anything that increases the eye pressure has the potential to cause damage. So have a discussion with your optometrist or ophthalmologist as to the safety of performing these activities based on your individual circumstances, especially if you have glaucoma or been identified as being at high risk of developing glaucoma. Now, the next eye-related risk for developing glaucoma is having thin corneas. This is the clear dome covering the eye, and this is something we can easily measure in an eye examination. A major study found that people with high eye pressures and thin corneas had a much greater risk of developing glaucoma than those with a thicker cornea. Studies suggest that people who have high degrees of nearsightedness or myopia or farsightedness, hyperopia, have a higher risk of developing glaucoma than the general population. For myopia, there's a higher risk of developing open-angle glaucoma or worsening of existing glaucoma, and the risk increases with higher degrees or as the prescription gets stronger. For hyperopia, the risk is for the less common type of glaucoma, which is narrow angle or closed angle glaucoma. A direct injury to the eye is also a risk for what we refer to as traumatic glaucoma. Now, the damaging increase in eye pressure can occur immediately after the injury, which is usually easier to detect and treat, but it can also occur months or many years later, which is concerning because the high eye pressure can easily go undetected. Now, sports-related injuries that cause bruising to the eye, the most common cause, usually due to the forceful impact of a ball, think cricket, squash, tennis, or even a fist or elbow to the eye. Now, it's very common for people to overlook the injury and the possibility of lasting damage when everything appears to have healed well. And this is why an eye examination is important after any eye injury. So next we move on to the systemic or health conditions that may increase the risk of glaucoma. When you see your optometrist or ophthalmologist, you will note that in addition to asking you about your symptoms, your eye and family history, we also take an extensive medical history, questions about your health and all the medication you may be taking. And this may seem unusual given you're there for your eyes, but the reason for this is that certain medical conditions can also cause vision-threatening eye disease, and this includes glaucoma. In fact, most medical conditions that are linked to glaucoma are the ones that cause damage to the blood vessels in the body and healthy blood flow. So it's generally understood that this then can also affect blood flow to the optic nerve. So let's go through some of these. Diabetes. So people with diabetes are at risk of developing multiple sight-threatening problems. Some studies have shown that diabetes doubles the risk of developing glaucoma. And having diabetes can cause more severe damage in existing glaucoma. Despite these findings, some question whether there is an association between diabetes and open-angle glaucoma. Now, in some cases, a severe type of glaucoma called neovascular glaucoma can occur in advanced diabetic eye disease, where new blood vessels grow into the drainage system of the eye and block the drainage system. So blood pressure problems. Now, we mentioned earlier that blood pressure and eye pressure go hand in hand to some degree, but studies have shown that both extremes of the blood pressure spectrum, whether it's having high blood pressure or low blood pressure, is a risk for open-angle glaucoma. Interestingly, very low blood pressure is a risk for worsening of existing glaucoma as well. So both vasospasm and Raynaud's disease refer to a problem with blood flow to the extremities, our fingers, toes, and are a risk for glaucoma. Now, symptoms of cold hands and cold feet are found in both conditions. However, to distinguish the two, in Raynaud's, there's also those characteristic colour changes in the skin, such as we see here, where the blood supply is interrupted. Migraines have also been identified as a risk factor for glaucoma, while some studies show that the increased risk is most significant in people in their 70s. Sleep apnea, specifically the most common obstructive type, where breathing repeatedly stops and starts for short intervals during sleep, is a risk factor for glaucoma. And those with sleep apnea also demonstrate a higher rate of glaucoma than those without. Also, the therapy for sleep apnea, continuous positive airway pressure, or CPAP for short, has been found to elevate the eye pressures at night, and so has the potential to lead to glaucoma. So those using a CPAP machine should have their eyes tested regularly. Those who have glaucoma and using CPAP should discuss this with their doctors. Okay, thyroid conditions. So thyroid over or underactivity can be a glaucoma risk, and studies have shown that a low functioning thyroid or hypothyroidism is an open-angle glaucoma risk because it can lead to an increase in eye pressure. Now, an overproductive thyroid gland, hyperthyroidism, such as found in an autoimmune condition called Graves' disease, can cause high increases in eye pressure, and this is usually due to swelling behind the eyes that can push the eyes forward and give that eye-popping appearance. So there are conflicting results in this space. Some studies show that smoking causes an increase in eye pressure, others show no difference. One major study, however, showed that smokers that underwent surgery to treat glaucoma had less successful outcomes than those who didn't smoke. And smoking has also been linked to the increased risk of many other eye conditions such as macular degeneration, cataracts, dry eyes, and Graves' disease, just to name a few. Okay, so most medications prescribed for health conditions are usually safe, but there are some to be mindful of, and these medications generally fall in the anti group, so certain types of antidepressants, anti-seizure drugs, and so forth. And in susceptible people, these medications can cause an increase in eye pressure, either directly or by affecting the drainage system of the eye. Now, the consumer medicine information leaflet, usually found inside the medicine packaging, typically includes a warning for these types of medications, especially for those that have been identified at risk for developing glaucoma or have glaucoma. So we recommend that you speak to your healthcare practitioner prior to commencing treatment. Now, two commonly prescribed medications that can significantly increase the risk for glaucoma if not appropriately monitored by an optometrist or ophthalmologist are topiramate, a medication that's prescribed for seizures and migraines, which has been linked to cases of closed-angle glaucoma. And secondly, corticosteroid medications, more often just known as steroids, where when these are used for prolonged periods, can significantly raise the eye pressure and increase the risk of glaucoma. Now, although this is especially true of steroid eye drops and steroid injections in or around the eye, it also includes steroid medication in tablet or liquid form, inhaled steroids, and even topical creams for skin conditions. Many other systemic diseases are also linked to glaucoma through secondary means, and I've listed a few here. However, we won't be covering these today for the interest of time. So we've pretty much covered the risks that I wanted to talk to you about this evening, but Glaucoma Australia has also developed an online quiz to help you assess your potential risk for developing glaucoma. So we encourage you to use this link or find the quiz via the Glaucoma Australia website, glaucoma.org.au. So based on what we've discussed, what do we do to prevent vision loss from glaucoma? Well, glaucoma can't be prevented, but when glaucoma is detected and treated early, we can prevent vision loss. So see your optometrist. Get tested if you have one or more risk factors for glaucoma. An eye examination is the only way to detect glaucoma. Find out your family history, and if you have glaucoma, tell your family. Take steps to avoid or limit activities that can cause unnecessary increases in eye pressure. Also, protect your eyes during sports or any other activity that could potentially cause an injury to the eye. Follow your eye care practitioner's advice with regards to attending the recommended appointments, and if using eye drops to treat glaucoma, we'll use them as instructed. And take steps to optimize your health and follow your medical practitioner's advice to effectively manage any health conditions. Okay, so what are the eye examination recommendations? Well, just like we take our car in for a routine 6 or 12-month service, even though everything seems to be running well, we also recommend routine checks as part of your eye health maintenance program. So for everyone over the age of 50, we recommend a comprehensive eye examination at least every 2 years, even if there's no problems with your eyes or vision. Now, we recommend that eye checks begin at 40 years of age and then every 2 years after that, if you have one or more risk factors for glaucoma. Or it could be even more frequent as recommended by your optometrist or ophthalmologist. Now, for some, eye health checks may need to start 5 to 10 years earlier. So see your optometrist in your early 30s if you are of African descent, or if a direct family member was diagnosed with glaucoma prior to the age of 40, or if it's very advanced. So everyone can take steps to protect their vision. Remember, the only real risk is doing nothing. Okay, so that brings us to the Q&A part of tonight's presentation. So let's look at some specific questions we've received from our members. Okay, so I don't know of anyone with my family with glaucoma. How is it that I got it? I can understand why this question would be asked given how much emphasis we place on the strong genetic component of glaucoma. And while one of the greatest risk factors for glaucoma is a family history of the disease, it is important to remember that anyone can develop glaucoma. The risk of glaucoma occurring in the general population is about 3%, but the risk is much higher for people that have a family member with glaucoma. So it may be that you are one of the 3% of the people that have glaucoma without a family history. And there's also all the other risk factors to consider. But recall also that 50% of people that have glaucoma don't even know they have it. So it could be that someone in your family has glaucoma but is not aware of it. So one of the most important things you can do now is to let your family members know that you've been diagnosed with glaucoma and encourage them to get tested. Okay, so let's go to the second question. How does corneal thickness affect eye pressure? That's a good question. So we mentioned that having a thin cornea is a risk for glaucoma, and this is one of the reasons why we measure the thickness of the cornea as part of the eye examination. Now, the other reason is because the accuracy of the eye pressure measurement that we take can be affected by the corneal thickness. The instrument that we use to measure eye pressures is called an applanation tonometer, and it's essentially designed to work on a cornea that is on average about 550 microns or 0.55 millimeters thick. So if the cornea is thicker than this, then the instrument overestimates the eye pressures to give a false high reading. So people can be misdiagnosed with high eye pressures when they really just have normal eye pressures, but their corneas are just thicker. On the other hand, if a cornea is thinner than average, then the instrument underestimates the eye pressures to give a false low reading. And this is more concerning to us because people who may have already damaging high eye pressures could be overlooked because the eye pressure measurement reads as normal. So this may delay the diagnosis of glaucoma. So in a nutshell, if the thickness of the cornea isn't taken into account when interpreting the eye pressure measurement, then the eye pressure isn't considered accurate. Okay, so question 3. I'm going backwards. Okay, so I was on steroid medication for approximately 2 years for a different health condition. Does that mean I have to regularly get my eye pressure checked? If so, then how often? Okay, this is a really important question. And steroids are useful and effective medications used in the treatment of many health conditions, and in the eye, they're the best treatment we have for inflammation, and we really couldn't do without them. However, steroid medications are well known for causing an increase in the eye pressure about 2 to 6 weeks after starting the medication, sometimes earlier, in about a third of the population. So use of steroid medication of any type may put some people at risk of what we call steroid-induced glaucoma, especially with long-term use. And those who are at highest risk are those that already have glaucoma, also those that have a family history of glaucoma, diabetes, a high degree of myopia or short-sightedness, a connective tissue disorder such as rheumatoid arthritis, the elderly, and children under the age of 6. So seeing an optometrist or ophthalmologist for a comprehensive eye health examination before starting the steroid treatment is crucial. And we also need to regularly monitor the eye pressures during the treatment period. Now, the frequency of pressure checks varies. It depends on the circumstances and the patient's individual risk. Now, usually we first check pressures a week or 2 after starting the treatment, and then every 2 to 3, sometimes 4 weeks for the first few months, and then less frequently for the remainder of the treatment period. So if this describes your situation over the 2-year period while you're on the steroid treatment, and there was no increase in eye pressure detected, then you would usually continue with the regular 1 to 2 yearly checks, or as was recommended by your eye care practitioner at the time, depending on your age and if you have any other risk factors for glaucoma. However, I feel, based on your question, that I may need to cover the remote possibility that your eye pressures weren't monitored during the 2 years of treatment. And there are 2 possible scenarios here. It may be that your eye pressures weren't affected by the steroid medication, as is the case in 2/3 of the time. But if, however, the eye pressures did increase, there is a strong possibility of damage to the optic nerve without you experiencing any symptoms. Now, in the majority of cases, when the steroid medication is discontinued, the eye pressure gradually goes back down to its usual pre-treatment level. However, in some cases, the eye pressures can remain elevated, especially with prolonged use of the steroid. So, given the length of time that you're on steroid treatment, yes, it is essential that you see an optometrist for a comprehensive eye examination as soon as possible to check your eye pressures and the health of your optic nerve. And be sure to relay the name of the steroid medication you were taking and the dose. And then, based on your eye examination results, your eye care practitioner will then recommend the appropriate frequency of eye examinations. Okay. And our final question, how does blood pressure affect my glaucoma? Another great question. So blood pressure and glaucoma are connected. The relationship between very high blood pressure and glaucoma is somewhat of a complex one, but we can presume that if having high blood pressure is a risk for developing glaucoma, then for similar reasons, it's also very likely to be a risk for worsening of existing glaucoma. Now, on the other hand, studies show that having a low blood pressure plays more of a significant role in glaucoma. Now, blood pressure can be naturally low or as a result of taking medication for high blood pressure, what we call overtreatment of high blood pressure. And older adults, especially those who take a certain type of high blood pressure medication called beta blockers, may be particularly susceptible. And this is because when the blood pressure is too low, the blood flow to the optic nerve is reduced, and so can damage the nerve and lead to glaucoma. And this can be more of a problem at night during sleep, as our blood pressure naturally drops during this time. But interestingly, when we sleep at night, the opposite happens to our eye pressure, where the eye pressure actually increases. And there's mounting evidence to suggest that the combination of a low blood pressure and high eye pressure at night can cause accelerated damage in glaucoma. And this may explain cases where there's worsening of glaucoma, even though the eye pressures appear to be well controlled. In these instances, we can arrange for 24-hour blood pressure monitoring, and if a low blood pressure at night is confirmed, well, this can help us better manage your glaucoma. So having a blood pressure that isn't too high or too low is very important in glaucoma. But the balance between a well-controlled blood pressure and eye pressure is also very important. And this is why it's important that all your healthcare practitioners are aware that you have glaucoma, and if you're using eye drops, the type of eye drops, and that all your eye care practitioners are aware of your medical conditions and all the medications you are taking. And it's also important to report any symptoms such as dizziness, feeling lightheaded, that can occur after standing up too quickly, as these symptoms can sometimes be our only clue that your blood pressure is too low. Okay, so that brings us to the end of our presentation tonight. So thank you for your attention and for your great questions. Please don't hesitate to contact us if you have any more questions regarding anything that we've talked about tonight. And until next time, take care and have a great evening.